Hello, my name is Bill Marston. I'm one of the vascular surgeons at University of North Carolina, and I direct the Wound Healing Limb Preservation Center there. We started this clinic approximately 15 years ago as a way to reduce amputations in the state of North Carolina. And I'd like to share some of the information of the patients that we treat and how we can partner with you on these patients. This would be a typical patient we'd see in the clinic. A 44-year-old male presents with 3-month history of a heel ulcer that's been resistant to healing using the typical treatment pathways. Has diabetes and peripheral neuropathy, and has significant arterial insufficiency on Doppler studies. These are common patients. We see them in our clinic frequently, and you have probably seen them as well. In fact, over 50,000 patients in the state of North Carolina will develop limb ulcers that are resistant to healing, and over 4,000 will suffer amputation this year alone. Importantly, the average life expectancy is less than 5 years for these amputees, which makes it a more severe disease with worse outcomes than many forms of cancer. What are the risk factors related to amputation? Well, some of these are elderly population, male gender, diabetes, which results in peripheral neuropathy and deformities leading to high pressure areas, and arterial insufficiency. About 85% of our patients that end up with an amputation first develop a non-healing foot ulcer, and we think this is a good opportunity to prevent amputation by treating them early. There are many opportunities to prevent amputation, but it really starts with early foot screening of patients at high risk, such as diabetics and others with neuropathy. Early identification of patients with ulcers and referral to a specialized wound center also is very important. Revascularization for people with arterial insufficiency and aggressive wound therapy will result in more patients healing. I think it's no surprise to any of you. We all know the incidence of diabetes is increasing exponentially, so we're going to see more of these patients and at a younger age in the future. So our Limb Preservation and Wound Healing Center is designed as a collaborative multi-specialty center to provide all of the latest therapies to minimize the risk of amputation for these patients. We have podiatrists, vascular surgeons, vascular interventionalists, and others that are really dedicated to healing these patients and avoiding amputation. We also have numerous consultants at UNC, including plastic surgery, infectious disease, and endocrinology that can assist as needed in their care. While we provide many treatments that other centers do, such as the latest in endovascular arterial revascularization with balloon angioplasty, stenting, atherectomy, and other devices, we also continue to do surgical revascularization with skilled surgeons that can provide this technique. What we're very proud of are some of the other things that we do that many of the other centers out there don't. We look at this with the concept that we want to increase blood supply and oxygen to the wound while minimizing its demand. You can increase supply by revascularizing, but there are also some angiogenic strategies, such as hyperbaric oxygen utilization, that may do this without requiring surgical revascularization. Also, reducing demand by eliminating pressure, reducing infection, and debriding necrotic tissue are also very important. So one of the key things that we do is total contact casting. While this is the gold standard for offloading, it's utilized at only 10% of centers nationwide. We do this routinely for patients who will benefit, and we get very high healing rates with this modality. Also, hyperbaric oxygen has been utilized in an increasing number of these complex patients and will salvage some wounds that no other modality can do. What we're very excited about, however, is the potential for stem cell therapies. And we recently have just completed some initial phase studies with stem cell therapies for patients with non-revascularizable lower extremity arterial disease. The concept is to take healthy progenitor cells from the bone marrow, concentrate them, and then re-inject them into the leg that needs them for angiogenesis and to the development of new capillaries. In this recent study of 150 patients, we found significantly fewer amputations and adverse limb events with the use of stem cells. This project is now on to a pivotal trial, and hopefully we'll be able to offer this to all patients in the near future. Using these techniques and others, the incidence of major amputation at UNC Healthcare is reduced by nearly 50% in the last decade, and we're very proud of this fact. So in summary, the UNC Wound Healing and Limb Preservation Center is specifically designed to integrate the care of dedicated specialists to heal wounds as rapidly as possible and prevent amputations. We would like to support you in the care of your patients and work together to prevent these terrible consequences as much as possible. Thank you for your attention.